Good afternoon. We are in for an informative hour. I am Sebastiana Gianchi, the City Safety Czar. The aim of this hour is to connect our employees with good information and resources to help with your vaccine deliberation decision. We will be going through questions that we have received from you, the hardworking and very much appreciated employees and contractors of our beautiful city. I will raise questions via Dr. DeRaza a few different modules, and she will introduce the rest of our esteemed panel. But right now, I will turn the town hall over to Dr. DeRaza, our esteemed City of Baltimore Health Commissioner. She's a trained pediatrician who believes that equitable care is the basic right for all and will tirelessly advocate and has tirelessly advocated for programs that support the overall health and well-being of all Baltimore City residents. The city has been so fortunate to have Dr. Duraza's leadership during this COVID-19 pandemic. So over to you, Dr. Duraza.
Great. Thanks, Sebastiana. It is such a pleasure to be here today with these two esteemed panelists. So I do want to start by introducing them. And I will start immediately to my right, Mr. William Jones Jr., who is currently the president of Vulcan Blazers of Baltimore City, an African-American firefighters organization. Mr. Jones is a retired member of the Baltimore City Fire Department, proudly serving the citizens of our city for 37 years. Thank you so much for being here today. And then we also have Mr. Misael Garcia. Mr. Garcia is an ESOL paraeducator who works for Baltimore City Public Schools in South Baltimore. He teaches 7th and 8th graders, and his love and commitment that he's put into the community has really earned him the respect and trust of the Latinx immigrant community here in Baltimore City. He's currently serving as a vaccine peer ambassador for the Baltimore City Health Department, informing the Latinx community about the COVID-19 vaccine. Again, I thank you all so much for being here, and I will actually turn it over to Mr. Jones for opening remarks.
Well, thank you, Doctor. Good morning. I am extremely pleased to be here. As the doctor indicated, that I've been a member of the Baltimore City Fire Department for a number of years. Also raised in Sandtown. Currently a member of the currently president of the Vulcan Blazers. We've been serving the Northwest community of Baltimore for better than 50 years. I'm so pleased to be here, and hopefully with this panel, we'll be able to share information that will assist our city employees and citizens of Baltimore making an informed decision about the vaccine, about the COVID-19 vaccine. This is a very, very important topic that we'll be discussing today, and I just hope that you listen closely to the information that we present.
Great. Thank you so much again, Mr. Jones. Mr. Garcia?
Well, thank you for having me here. It's a pleasure. I definitely agree. It is important for us to share the information that we have, and it's important for our community to listen to the information that we're going to give them. I'm excited to work with you and everybody else that is fighting against this pandemic. So thank you for having me and giving me the opportunity to share my thoughts, my experiences with my community, and my ideas as well.
Thank you. And I'll just start by saying thank you all so much for taking time out of what I know is a busy schedule to listen to what we're going to talk about today. As both of the panelists have mentioned, this is such an important topic. And we know that making the choice to get a vaccine, it's a personal choice, and it's one that you want to have all of the information. So we're here today to be that credible source, to provide you with the information that you need so that you can make the best decision for yourself and for your family. With that, I will actually turn it back over to Tiana to start our questions.
Thank you, Dr. Duraza. So the first set of questions is going to be regarding contextual influences that affect vaccine hesitancy. And these three topics of vaccine hesitancy, contextual influences, individual influences, and specific issues about the vaccine, are from the WHO, how they categorize various forms of vaccine hesitancy. And I will also say that during this webinar, you can also still put in your questions that are being monitored at this moment via the portal that was in the eBlast. So the first set of questions, as I said, was on contextual influences that affect vaccine hesitancy. And these are influences that arise due to historic, sociocultural, environmental, health systems, or institutional issues. Sometimes they could be economic or other political factors. Examples include communication or media, leaders, history, or geography and transportation. So some of the questions that came in from our workers that we'll be highlighting, and hopefully we'll be able to get to all of them. I'll start with the first one. The first one says, my family has concerns that even if vaccinated, nothing will change with the lockdown, and we wish to wait to see how most people handle the vaccine first. In their words, let other people be the test subjects. So with that, I'm going to turn this back over to Dr. D to get her thoughts on that question.
Sure. I think that's a great question to start with. So one of the things we know, and we really are seeing this locally and across the country, is that vaccinations work in helping us reduce disease transmission. As we've seen vaccination rates increase among older adults, we've subsequently seen hospitalizations among older adults start to decrease. And all of this information, at least for Baltimore City, can be found on our website at coronavirus.baltimorecity.gov. So in time, as we're beginning to see this improvement, as we're seeing case rates come down, I do anticipate that there will be changes to what the current restrictions are. The second part of that question, and I think I'll start briefly and then turn it over to my panelists about, waiting and seeing. So again, certainly understand wanting to get more information given the vaccines. So to date, there have been clinical trials done for all of the currently approved vaccinations. And all of those clinical trials have shown effectiveness in reducing hospitalizations, reducing deaths, and reducing chances for severe disease as a result of COVID-19. We've had the vaccine available here in the States since December. So many people have been vaccinated, millions of people have been vaccinated since December. And the good thing about the process is that the CDC is monitoring any long-term effects as a result of the vaccinations. And so that information is made publicly available. And I would always encourage you to go to the CDC's website, cdc.gov, to learn even more. But we'll be talking a lot about that during today's call. And I'll turn it over to Mr. Jones.
Well, I think we're already seeing in Baltimore City, we're seeing a reduction in some of the restrictions for COVID-19, and that will continue. As vaccines continue to be administered, we'll see even more and more reductions in some of the restrictions for Baltimore City. We're going to get to the point where we'll have restaurants can fully open, other businesses can fully operate at full capacity. And in addition to not only just the business aspect of it, but also personally, you'll be able to protect it. You'll have a hedge of protection around yourself and your family and all your loved ones. So we are seeing an increase of activity in Baltimore City as far as opening up businesses. So what do you and we'll continue.
Did you want to add anything, Mr. Garcia?
Well, definitely, vaccines are working. I think that people need to allow themselves to understand that it's a process. Everything has to, it has to be step by step. We just know that the restrictions are coming out little by little, but in order for us to be at our full capacity, we want to understand that the public needs to take the lead and get vaccinated.
Thank you both.
Okay, so we'll move to the next question. This is more around historical or cultural issues. So I'll ask Dr. D, and then I think she will conduct a discussion with the group at large. Will I get an informed consent to read and sign before I am injected with the experimental vaccine? Please speak to African American historical issues with vaccination and also discuss distrust in the Latinx community.
Yeah, I'll maybe take the first part of that question, then I'll turn it over to my fellow panelists. So the Baltimore City Health Department is one of many providers of vaccine here in Baltimore City. And we do a couple of things when people get their vaccine. So the first thing we do is we have a list of questions that we're asking about your past medical history so that we can understand if there are any underlying risks or comorbidities that our team needs to be aware of prior to you getting vaccinated. We also provide the emergency use authorization form. So these vaccines, all of the ones that are currently approved by the FDA, are approved under what's called an emergency use authorization. In time, they will have full authorization from the FDA. And I know Pfizer's in the process of applying for that now. So we provide that information that goes over any side effects from the vaccines, that provides some information regarding the clinical trials and the effectiveness of the vaccines, as well as the ingredients within the vaccine. And we provide that to anyone that's getting a vaccine on that particular day. So we're very upfront about that information. Again, can also be found online at fda.gov or cdc.gov. Now, for the hesitancy among African Americans, maybe I'll turn it over to Mr. Jones to start that discussion.
Well, I get it as far as the concern in the African American community. We only have to think about the Tuskegee experiment. Locally, we can talk about Henrietta Latt's situation at Johns Hopkins Hospital. The bright side of that is that this vaccine was the current vaccines, the vaccines that we are now administering, was not pioneered, but it was certainly developed by a young African American woman, Dr. Corbin, as a matter of fact, is her name, who was trained locally here at the University of Maryland, Baltimore County. She's been credited by Dr. Fauci and the NIH community for her involvement in developing this vaccine. This vaccine has proven to be very effective and safe. And I would encourage all of us, those who are hesitant about taking this vaccine, to read the documentation regarding Dr. Corbett, the research that continue to go, that's still ongoing with Pfizer, Moderna, and Johnson & Johnson, the three main pharmacies who are producing these vaccines. I encourage you to read the documentation, to read the reports on these three vaccine producers. But it is very encouraging to know that Dr. Corbett was involved with the development of this vaccine.
Great, thank you for that. And then there was the third part of that question, which really asked about any particular hesitancies in the Latinx community.
Yeah, well, trust is always an issue, especially in my community. The language barriers definitely, doesn't allow our community sometimes to take a minute to probably, read information that is on a piece of paper or on a website. And definitely we need to, at least from my perspective, I think that our Latinx community, as it grows, we are out there in the field working, and essential workers that are exposing themselves every day and coming back home with their kids and family. And but the trust that is missing still, because our community, you know, it has a generation of, you know, probably, maybe you want to say the government, if that's how they probably feel, the government has not given them the opportunity to trust in them. We have been attacked for many years, and the work that needs to be done is I think is double than and than in other communities, I think. But encouraging and leading by example as a member of that community, I think helps to create and build that trust.
Great, thank you.
Okay, so moving on to the next question regarding safety. It reads, I'm undecided. I do not think it is safe. I heard from social media it is not safe. What other things can I do to lower my symptoms of COVID-19 that do not involve taking what appears to be a risky product?
So I'll start by saying that the vaccines have all been proven to be safe and effective. I would start by going to credible sources such as the CDC, so cdc.gov, our website as well, coronavirus.baltimorecity.gov. If you have a primary care provider, that's another great resource to have conversations if there are particular medical or clinical questions that you have about the vaccine. So again, all three of the vaccines have been approved under emergency use authorization and have been identified as being safe. The only vaccine that did have a pause in its usage was the Johnson & Johnson vaccine, and even that was out of being particularly cautious and wanting to evaluate some side effects that they heard about. And so when they evaluated those side effects, it was noted that there was a risk of a very rare clotting syndrome in particularly women between the ages of 18 and 50. And so those women may want to consider an alternative vaccine. However, again, all the vaccines have been proven to be safe. Even for those that are vaccinated, the things that we can all do to keep ourselves safe. So we're going to continue to wear a mask indoors, continue to wash your hands, continue to stay home if you're not feeling well, continue to get tested if you're showing symptoms of COVID-19. Again, even though I think, we have maybe less new cases, COVID-19 is still among us. So we all want to be particularly careful. And that involves getting tested if you're even the least bit concerned that you might have symptoms. But please continue doing all of those things that have kept many of us safe this past year or so.
Great, so I'm going to move on to the next module of questions, the individual and group influences. And the next question is regarding various myths that the group might have heard or want to discuss. The question is, my children do not want the shot because they believe the rumors that the government added something that will allow them to monitor and control people. How do I deal with that? Also, what is the best website to find out where testing is being done and where shots are available?
Great question. So I'll start with the website, coronavirus.baltimorecity.gov. And that includes our mobile testing schedules for the week, usually a week at a time. Additionally, we will be posting our schedule for vaccination there. Maryland, coronavirus.maryland.gov has locations of vaccinations across the entire state. Now, for the rumors, I'm actually going to turn it over to Mr. Jones and Mr. Garcia because we were having a little bit of a discussion on some of the rumors that they've heard as well.
Yes, we've heard a number of unbelievable rumors in regards to the vaccine. All of them are just simply unfounded. It's like there's a new one almost every day. Again, the doctor mentioned earlier in regards to a credible source. Go to credible sources to find out about the vaccine. There are websites that will provide you information in regards to the vaccines. Our problem one of the problems, and this is ongoing. This is ongoing problems with the vaccine, with some of the rumors. I can't begin to. I mean, I'm sure you've heard many of these rumors, and honestly, every rumor that we've heard, we've been able to debunk, because there's nothing to substantiate some of the unbelievable rumors that we've been hearing about the vaccine. Again, go to a credible source to find out more about the vaccines.
Well, the question mentioned children, right? I'm an educator. I work with kids every day, and I heard these questions definitely, and these concerns coming from them. Um, for me, as an educator, I think that, educating myself first of all about with the data that is out there, credible sources, like you mentioned, is important, because uh, it allows me and it helps me to have this type of conversation with my students when they come up with this type of comments, and they say, "Oh, I've heard in social media." We cannot always trust social media, um, and I heard these rumors. So it's like for me, for me this is like having a class, like a math class, science class, whatever the subject is, uh, knowing the information that I have that is credible source, is right information that I know that is truth, helps me to educate my students. But most important, it helps me to educate parents, right? Because as educators, we gain the trust of our students, but a student will always trust their parents more than anybody else. So that for me is the key: educating the parents, uh, uh, showing them the information, providing them with the information that they need, so that they can, share with their kids, so they can erase those rumors, and get them out of their minds, and uh, by building that trust, again, coming back to the trust, building that trust with the parent and the educator, um, we are able to assist the student and young kids. It goes side by side. We gotta make sure that we guide them through the right path, so they can make the right choices, and um, that they can understand that before they say anything, uh, they have the right information, and don't say something that will become a rumor.
Good. So we're moving on to a question regarding children now. According to the CDC's own numbers, COVID-19 has a 99.74 survival rate for young people 0 to 19. So why are COVID-19 injections recommended to 16-year-olds? I do not feel comfortable being vaccinated, and my child is not yet eligible. Dr. Duraza.
Yeah, that's a great question. And so two things. I will start by saying I'm a parent and a pediatrician. So double the experience of thinking about vaccination in children. And what I'll start by saying is that although we know that children tend to get less ill, we do see cases of children becoming extremely ill as a result of COVID, especially if they have underlying health conditions. But unfortunately, it still happens, though it is rare. And so for that reason, I would consider vaccination in your child. I have a 19-year-old stepson. He's fully vaccinated because he was eligible. I also have a 4-year-old at home, so not yet eligible. But in the months to come, as research is done, it will be my job as a parent, as a pediatrician, to read the information on the clinical trials for children his age, and make that decision to get him vaccinated. And so the good news is there are clinical trials happening in children that age. So that data will be forthcoming. I think it's again important to take all that information from a credible source. So if you have questions and you have a pediatrician or a care provider for your child, that's a great source. Start with them. Tell them what your concerns are specifically, so that they can kind of help guide you through that decision, just like they would any other vaccination, right? As we know, children are required to get a lot of vaccinations for school and other things. So totally understand why there would be some reservation in this population. But I think, again, do your homework, find out more information so that you can make the right decision. The other thing that we do think about with children is even though they don't get sick, they can still spread disease. Particularly that 12 to 15-year-old age group, they spread it very similar to older people, right? And so, vaccinating them can help keep others safe from possible transmission. And again, we've got to get as many people vaccinated as possible so that we can get back to some sense of normalcy.
So this actually leads us to the next question, which is about transmission. And the question states, I have been completely vaccinated, but I am concerned about coworkers who do not want to get vaccinated because they are not worried about getting COVID. Are unvaccinated people more likely to spread the coronavirus than those who have been vaccinated?
Yes, short answer.
Yeah.
Yes, if you're unvaccinated and you get COVID, you are more likely. So generally, if you have any type of symptoms, typically it's that symptomatic and maybe a few days before you start to show symptoms that you're likely to spread it. Most studies indicate that people who are vaccinated are at much lower risk for spreading COVID-19. So they're just not they're thought to be shedding a lot less virus, and really it's our viral shed is what kind of passes that virus on to others. So if you have been vaccinated, though in some instances people who are vaccinated can still get COVID-19, as I mentioned, you are a lot less likely to be sick. You're a lot less likely to require hospitalization. You're a lot less likely to have a negative outcome as a result of having COVID-19, and there's less spread for people who are vaccinated versus people who have not been vaccinated.
So we're in this technical section now. So I see some incoming questions that are also possibly ones that fit in this section. So I'm going to ask those now as well that are coming through. Is it not true that the Pfizer vaccine is in year 1 of a 3-year clinical trial?
So again, talking a little bit about clinical trials generally. So generally, clinical trials can be a bit longer. The clinical trials, the difference with these vaccines is that everything was kind of done at the same time, right? As opposed to, waiting until you had been approved for the clinical trial to begin development. There was development of the vaccine and production, mass production, at the same time as the clinical trials were occurring. For the people who were part of the original clinical trials, we'll continue to follow them. So I think, Mr. Jones mentioned, right? We'll continue to follow them to see what their long-term effects are. We are continuing to understand, do we need a booster? I believe that's a question that's going to come up as well. And most people think we will. So again, with COVID-19, with it still being transmitted, with the development of variants or mutations, which are common, it is likely that we'll need a booster. And we'll continue to study these vaccines, just as we're continuing to study COVID-19, the disease itself. I think something we forget, we've been living with COVID for what feels like a long time now, but it's still a very new virus. And there are still many things that we're learning about it, and many things we'll continue to learn about the vaccine.
Right. And then lastly, the ingredients question here in this technical section, and maybe the other two can speak to religious beliefs. This question is going to come up to various religious beliefs as well. Can BCHD provide a complete list of the Pfizer, Moderna, J&J COVID-19 ingredients currently being administered in the US? And can BCHD certify that the experimental vaccine does not contain aborted fetal cells or traces of human DNA? That would go against my religious beliefs.
Yeah, so all of vaccine materials, if you go to cdc.gov, you can search and they have a list of everything that's within the vaccine. And to our knowledge, there are no aborted fetal cells within the vaccine. But again, all that list of ingredients it can be found on cdc.gov as well as fda.gov.
Yep,
Yeah.
I agree. I mean, those every ingredient involved with the vaccines is listed on the various websites of each pharmaceutical company. So, by all means, as the doctors said, do your homework. Just go to the websites and discover all the good, credible information that's there for you to take advantage of. So, by all means, do so.
Mhm.
Okay.
In terms of religious, um, I haven't heard that. I've heard all kind of excuses as to why, but religion is one that I haven't heard. So really can't speak to that in regards to religion.
Um, yeah, in terms of religion, I mean, I'm a man of faith, and in my case, at least, I think I was part of this. I was part of the people that feel unsafe or feel that I don't trust the vaccine before I got my vaccine. But for me, I was it was putting my faith in God first of all. But I had somebody come to me and say, how you gonna put your faith in God, but you trust in a vaccine that was man-made? My response was pretty much that I have faith in God because it, if God guided these men to work hard for to create the vaccine, then it's a chain, right? It's a domino effect of believing that God gave them the knowledge, gave them the resources to be able to create the vaccines that we have now. Then I trust the men because they were guided by God. That's my personal belief. I mean, and I respect everybody's opinion on that. But that's what made me take the decision that I took when it came to vaccinating myself.
Thank you for sharing that. So now we'll move on to the third module, specific issues related to vaccine or vaccination. This is issues that come up with the mode of administration or the process. And then hopefully we can double back on some of the incoming questions that are coming in via the portal. But this is a question regarding length of immunity. How long is the vaccine good for? Is another vaccine coming behind this one? What percentage is this vaccine protected against not getting COVID-19?
Yeah, so again, I think we're very much studying the length of efficacy for the vaccines. So one of the things we do know is that when we think about someone who's had COVID-19 disease versus someone who's vaccinated against it, that the vaccine seems to convey more immunity. So it seems to prep and prime our body to have a stronger immune response than if we just have the disease alone. As far as the length, it's variable. So I think it's thought that it could be 6 to 9 months. Maybe longer for some people, maybe shorter. So that's when I kind of alluded to the possibility of boosters for the vaccine, especially in light of the variants. That's what I was thinking about, right? So similar to how each season there's a new flu vaccine, because we know that the flu changes, the virus itself changes slightly from season to season. It's very likely that that will be the case with the COVID-19 as well, that there may be some form of a booster immunization in the future.
Okay, another technical one regarding research that's available. When is access to the raw data from the COVID-19 clinical trials going to be available? And what patient populations were excluded in the COVID-19 vaccine trials?
Yeah, so again, 3 different vaccines, and so each trial is slightly different. That data is available now. So again, the Pfizer vaccine was done in 16 and up, and it was people that were healthy, but also included people who had underlying what we call comorbidities or other health conditions. Same thing with the Moderna vaccine. So I think they really tried to replicate the population here in the U.S., but some of the trials were also done overseas as well. Again, that data is available now. If you go to cdc.gov, or if you go to that particular vaccine manufacturer, you can learn more about what that data is. It can sometimes be a little bit tough to digest, but it is there now. What with both the Moderna, which is the 2-dose vaccine, and the Pfizer, efficacy is thought to be about 94 to 95%, or it was in the people who were in the clinical trial at that time. Now, we also understand that those vaccines were trialed before variants were as widespread. And so we see slightly lower efficacy with the Johnson & Johnson vaccine, but we know that the Johnson & Johnson vaccine was trialed during a time where there were more variants circulating. So there was, more different forms of the SARS-CoV-2, and we know that additionally it is effective against some of those variants as well.
Okay, and another question regarding testing that just came in via the portal. For Pfizer and Moderna, there was no animal testing done. Is this not a Nuremberg Code violation?
I'm sorry, what was the word you said? What code?
Nuremberg Code violation.
So I am not familiar with that.
Yeah.
Again, what I'll say is that these vaccines were moved through to phase 3 so that we could quickly develop and have a vaccine that was readily available for use. All 3 of them have been approved under emergency use authorization by the entities in our country that do those approvals. And it is a very scrutinous process to get approved in the first place. So again, I trust that all of the right steps were taken and have read the clinical trials again, which show very high efficacy in protecting against disease. For those that are interested, since there are questions about efficacy and those types of things, the CDC, so it's a council within the CDC, the Advisory Council on Immunization Practices, ACIP, for anyone who wants to get very technical, they publicly display all of their meetings. And so this Wednesday, as they're reviewing the Pfizer vaccine for 12 to 15-year-olds, that's actually publicly available. So anyone who has internet or computer access, you can pull up that information to learn more about the process.
Okay, now we're going to move to some mask and distancing practices that maybe the others can also speak to. This is a question: if I get the vaccine, do I have to keep wearing a mask and social distancing? Does the vaccine not protect me from SARS-CoV-2, so not to develop COVID-19? Can vaccinated people spread COVID?
Well, I'll say so. The schools have taken um, very serious, the coming back to school in person for students. We know, at least, I know that our protocols are um, they're important. I mean, us as teachers, we have made the decision of getting vaccinated because we wanna, at least for myself, I wanna live as an example for my students, so that they can understand that this vaccine is actually working, and that they can trust the vaccine. Now, in schools, we are following every protocol possible, keeping our distances, making sure that we are always wearing our masks. I even wear a face shield and a mask myself, not because I don't trust the vaccine, but because I think it's the right thing to do. I think that, you know, uh, for the respect towards our students that have not been able to get vaccinated, uh, I wouldn't feel comfortable, uh, not wearing my mask. I think this has become part of our lives now, and I actually feel uncomfortable when I don't have my mask on. So, and in the classrooms, our students are always 6 4 feet apart when they're on desks. Nobody can touch nobody else, other students' stuff. We got people around the building always sanitizing and cleaning, disinfecting, and making sure that all that happens. The students definitely understand that the social distance is important. Washing their hands when they go to the bathroom, and us teachers as well, right? We are there. We want to make sure that we are protecting them, because even though we already have the vaccine, like we already got vaccinated, uh, we want to make sure that they go home safe to their parents, and they can come back to us then the following day. So making sure that yes, the vaccines work, but not because they work doesn't mean that you have to stop wearing your mask.
Mhm. If I can add to that, there have been some face mask restrictions modified or lifted, um, but we still should wear our our face mask, um, um, especially still in the public. Even though you received the vaccine and you're fully vaccinated, you still should wear your face piece. Oh, I keep face piece. Um, your um, your face mask, you still should wear it. Simply um, because everybody's not hasn't been vaccinated yet. So until the numbers of vaccinated people increase to the point where protocols for the mask wearing can be changed again, to where we won't have to wear them as much as we do now. There are certain circumstances at home you can take it off, especially if everybody in the at home has been vaccinated. Around I think it also was listed if you're outside. If you're outside, you're not required to wear a mask. However, I still do because again, I'm not sure who has been who has received the vaccine. So until those vaccine numbers are increased, we still will continue to wear a mask in certain situations.
Thank you, Mr. Jones. And Dr. Draz, if you could just add on that regarding the differentiation between public and private in regards to the CDC, especially for our workers. And again, just to reiterate, can vaccinated people spread COVID-19?
Yeah, so starting with the first question, and vaccinated people, we believe have much less viral shed in the event that they get COVID. So they are much less likely to spread COVID-19 disease. All studies have shown that it's very unlikely that those that have been vaccinated, even if they get COVID, are likely to spread it. I think Mr. Garcia and Mr. Jones touched on it well, right? There are certain things that, per the CDC, we can do if we're fully vaccinated. Namely, the CDC has said it's okay to be outdoors without your face mask on, except in certain venues. So, like an outdoor venue or a ticketed, large event where there may be large numbers of people, the CDC has advised that everyone be masked. But if you're unvaccinated, you can be outdoors without a mask. And actually, I think as Mr. Jones mentioned, the city lifted that restriction to allow you to be outdoors without a mask. But like Mr. Garcia said, sometimes we keep our masks on just to be safe because at this point, only about 40% of city residents have received at least one immunization, and only about 30% of city residents are fully vaccinated. So the vast majority of city residents are unvaccinated. And so just out of an extra level of protection, I still see a lot of people wearing their masks outdoors, even though that restriction has been lifted. And certainly indoors, vaccinated or not, unless you're around, like you mentioned, your family member, or maybe one other household where they're also fully vaccinated, that mask really should stay on indoors, particularly in a workplace setting as well, because it is mixed company. You don't know who's been vaccinated. So that policy of being masked indoors remains in place.
Perfect. Thank you. And this last one for this set is on side effects. Can BCHD inform us of all contraindications and potential side effects, repairable or irreparable, in the short, medium, and long term?
Yeah, so again, we can speak a lot to the short term, right? And this is based on the data from the clinical trials. We're still collecting long-term data, but for most vaccines, most people experience, if any side effects at all, some people don't get any, but maybe soreness at the arm, or soreness at the site of injection, fever, low-grade fever, headache, fatigue for some, chills for some, usually a day or two. After that second vaccine was more prominent for the Moderna and the Pfizer, or after that the Johnson and Johnson vaccine. Again, as far as contraindications, there aren't many. It really is if you've had a severe allergic reaction to ingredients within the vaccines. If you have particular concerns or particular allergies, it's always wise to talk to your allergist or immunologist to delve into those. But again, you can look through that list of ingredients to see if there's anything that you could possibly be allergic to. Again, short-term side effects, I'll reiterate it, they're mild, headache, fatigue, soreness at the site of the injection, maybe fever or chills as well.
Great. So we're right on time. We're able to move to the questions in the portal that have come in. So the first one from the portal, how is COVID-19 reduction rate influenced by the lowering the cycle threshold of PCR testing? For Dr. Daraza.
Yeah, I honestly do not follow that question. I'm not sure I understand what they're asking.
I'm not understanding how they phrase it either. I think they're saying, is PCR testing affecting the COVID-19 positivity rate?
Um, So is PCR testing effective? So we are still testing throughout the city, and there is PCR testing that occurs. I don't necessarily know that it's affecting the positivity. We have not seen
Mhm.
our rates, well, let me say, we have not seen the total volume of our testing drop significantly. We've seen that across the country, we've seen that across the state, but Baltimore City actually still has pretty high numbers and volume of testing comparatively. So I don't know that we've seen a significant implication. We have seen our positivity decrease over these past few weeks, so that is good news.
Okay, and this question is regarding death. What about the increasing death rates and serious side effects being reported on the CDC VAERS website? December through May 3rd, and the total that now stands at 4,178. And I think the other question that comes in here is really, has there been a death that came after a vaccine?
Yeah, so I think again, we certainly have seen lower rates of death, hospitalization, and illness as a result of COVID-19. Again, the vaccines aren't necessarily 100% effective, so there are still some individuals who have been vaccinated and fallen ill. When we look at the rate, though, of illness and severe outcomes compared to those who are not vaccinated, it's significantly lower. So again, nothing at this point is 100% effective, but I think that also stresses why, in addition to getting vaccinated and encouraging people you know to get vaccinated, we do continue some of the safety measures like wearing of the mask and washing our hands and getting tested to give us that additional layer of protection.
Okay. Next question is regarding hesitancy again. My hesitancy is the lack of experimentation between its creation and when able to inoculate the entire population. The test size was too small to draw conclusions as to the side effects for me to be comfortable.
Yeah. So, the clinical trials were comparable to other clinical trials. I think again, what a lot of people feel nervous about is the length of time to going through the clinical trial to actually having a working vaccine. But the numbers within the clinical trials are comparable to the numbers of clinical trials for other medications and vaccines as well. So there wasn't a significant difference there.
Okay. How is BCHD making preparations for the return of city employees?
Yeah, that's a great question. So we are fortunate at the health department to really work hand in hand with other city agencies. And in May of last year, the city actually established a city reopening services committee. And so we serve as a part of that committee, which provides oversight to the city on how to safely reopen. So again, we're a part of a larger group of other city agencies, as there are many agencies that reopening obviously has an impact on.
And the next question regarding telework is Baltimore City considering making telework a part of the permanent schedule for staff for those eligible because vaccination is not mandatory right now? Will this be considered? And we have Michael Tate here from the HR to answer this question, and he says that this is why there's currently a survey available to employees and that this final decision will be conducted by the mayor on that. And what about the transmission of the spike protein? Has the right. What about the transmission of the spike protein? I don't know if that makes a lot of sense, Dr. Draza.
So I think it's not, yeah,
Yeah.
maybe a little
Okay.
bit more to that. But
Last one. I heard of a lot of people who are low income or who are experiencing homelessness have vaccine hesitancy, not because of the vaccine itself, but because of not being able to afford dealing with multiple days of post-vaccine side effects. What can we do to incentivize getting vaccines for people who can't afford to take days off work for sickness? These people are in vulnerable populations and ought to be given special consideration.
so I'll maybe start off a response and then turn it over to the other panelists. So one of the things I will say is that the health department early on established what we call our value communities, or those communities that we knew were particularly vulnerable to getting COVID-19 or to being more hesitant to potentially get a COVID-19 vaccine. And that includes our residents experiencing homelessness, as well as the pediatric population, as well as young men between the ages of 18 and 24, our African American community, our older adults, our Latinx community. And so with those groups, we have ambassadors, so vaccine peer ambassadors. I'll let Mr. Garcia talk more about that. But again, they can provide education and outreach. And as a part of that, we can talk about, okay, what are the implications of getting the vaccine? And while I understand the concerns about having a day or two of side effects, I think it's also important to consider the implications of getting COVID-19 disease if you're not vaccinated, and the sustained period of illness that you could experience with actually getting the disease. So I would really think about that as well as you kind of think through, is it worth experiencing these side effects? And I think talk with your employer. I think most employers would be amicable to you getting the vaccine if it meant that it prevented you from getting the illness, which could have much more severe implications. But I'll certainly turn it over to Mr. Garcia to talk about some of the work of our vaccine peer ambassadors.
Thank you. So yes, as an ambassador for Baltimore Health Department, working with the Latinx community. See, our community, we are committed to work.
Mhm.
We love to work, and we are willing to work 7 days a week if possible, 2 to 3 jobs if possible. The problem with that is that we are afraid to lose our job. We are afraid to take a day off because, oh no, my boss is gonna say he's gonna fire me, he's not gonna let me, or whatever. And that is the biggest problem in our community, in my community. Um, I think that when I do the outreach that I've been doing especially in South Baltimore, Patapsco Square area, Lakeland, Brooklyn. um, I come across with a lot of members that you know want to get the vaccine, but they say, "Oh, I cannot take the day off." Um, the good thing about making an appointment with the vaccine is that probably you can make an appointment of 2 weeks ahead, and that gives you plenty of time to talk to your employer, to talk to them. Listen, I'm getting vaccinated. I need this day off. So that's the good thing about making an appointment and getting back to get vaccinated. Uh, and you mentioned, right, like eh, I'm straightforward. And do you rather lose 2 days because you got side effects after you got the vaccine, or do you want to miss 15 to 20 up to 30 days for being, for
more.
being, uh, for having COVID-19, right? And that allows me to kind of break that barrier, it allows me to create awareness of this situation because um they start thinking about, well, you know what, you're right, I'm not gonna get paid 30 days. I'd rather not get paid 2 days or 3 days is better than going that amount of time. So that makes my job a lot easier, right? Because um we 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 wanna make sure that they also have that trust with their employer, that communication, because in my community we are assuming that because if we miss one day they're gonna fire us, because if we miss one week we're gonna lose our job. So and that's the problem in the Latinx community, that we assume that our boss is not gonna give us a job, is not let us work anymore. So that's been part of my job, right? Part of my job, making sure that they understand that they need to create a relationship with the employer. And I mean, we're in a time where I think everybody understands what's happening, and that are willing uh, to be more flexible with their employees and with their business. So, yes.
Well, actually, I have to admit, this is the first I've heard about someone being concerned about losing time from work because of the effects of the virus. I mean, the vaccine. Um, really haven't heard much about that, but I think Mr. Garcia makes some really excellent points. Um, I think the key, and as Mr. Garcia mentioned, is to talk to your employer, to let them know that you're going to take the vaccine, and this could be a possibility that you may have, you may experience some type of side effects, and what's the plan of action in case an uh, uh, employee has side effects from the vaccine. And but really, I don't mind losing a couple of days instead of losing the job, or losing the week or the month, because I have a severe case of COVID-19. So so that's it. I think the key to it is to talk to your employer before you take the vaccine. That should not be a hindrance of you taking the vaccine, because it will protect you.
Yeah.
It will protect you.
And I would like to just add up something real quick. The fact that, when having that conversation with your employer, right, it allows him to actually respect you for coming forward and say, okay, and telling you this to, um, so the employer is already aware that this is going to happen. Compare us if, you tell your employer, or your employer finds out that you got COVID-19, they automatically will cut you off completely. They will remove you because they don't want to risk, closing down their business.
Thank you so much, both of you. I see we're at the bottom of the hour. I do want to give Dr. Duraza the last word to just state anything else she'd like as closing remarks. Potentially something with the Office of the Labor Commissioner, who has also spoken to our city employees about how, and tried to make accommodations and to make it feasible for this to happen. I think she is on our side to make sure this happens. So Dr. Duraza, please.
Yeah, so I mean, I think, just like there was administrative leave to attend this, I think the city really recognizes the importance of the workforce being vaccinated. So there is permission leave. Many of our employees took the permission leave. I took the permission leave when I got my vaccine, for that time period to be able to get it. So that's extremely important. I think if I were to close with one thing, again, hopefully this hour was helpful. As you want to learn more, please don't hesitate to check out our website, coronavirus.baltimorecity.gov, or the CDC, cdc.gov, for additional information, or even talking to your clinical provider if you have specific questions. But again, vaccinations really are key to getting us back on track to some sense of normalcy. So I hope that everyone would seriously consider getting a vaccine and the implications being vaccinated has on you and your family.
So thank you so much to all of our guests, and we will keep this portal up, and the Team Up program will monitor it to make sure that we can get answers from our city clinicians to you all. So feel free to continue to post your questions there. And thank you for your time this afternoon.